Ebola virus is transmitted to humans through infected bushmeat, such as bats, monkeys, to mention but a few. The Ebola virus is easily transmitted from animals to humans during hunting, slaughtering, and also preparation of bushmeat. For example, people who eat monkeys, bats, and other wild animals are at a greater risk of getting the Ebola virus disease. And in this phase, we are having the Ebola virus bundibujjo strain. And after the initial contact person is affected or is infected with Ebola virus, that individual can now start transmitting the disease to nearby individuals, human to human transmission, and directly through physical contact of healthy individuals with the infected individuals. And hence, gatherings in an endemic region or in a region where people are already suspected of having Ebola virus disease is always not recommended, because physical contact will directly increase the spread of the illness. And in today's video, we shall talk about the common ways on how Ebola virus disease is spread, and include the following. Number 1, shaking hands with an infected person. Number 2, touching a sick or a dead body of a person infected with Ebola virus disease. Number 3, touching the vomiters of a person having Ebola virus disease. 4, touching the clothing of a person infected with Ebola virus disease. 5, touching the beddings of an Ebola virus infected patient. 6, touching the feces or other human wastes of an infected patient. 7, sharing beddings with an individual affected or infected with Ebola virus disease. So basically, Ebola virus disease is spread through direct and physical contact. And point of entry of the disease can be the hands, especially when there is a wound, 2, the nose, the eyes, or any other mucous membrane areas. And lastly, to avoid the disease from spreading from one individual to another, from another to the next, then we as the communities should take caution and precautions to ensure the standard operating procedures of Ebola virus disease in order to curb the disease. And the standard operating procedures are specific depending on target groups or depending on the level of exposure to the disease. For example, for the general public, they can ensure hand washing with soap or disinfectant. Number 2, they can avoid physical contact with people who are sick, or people who are suspected to have Ebola viruses, or people of unknown origin. And also avoid public gatherings, because you never know who is infected or who is not infected. So any physical contact with a person who is infected, knowingly or unknowingly, will predispose you to getting Ebola virus disease. And for the specific target groups, for example, for us, the health workers, we shall continue using the personal protective gears, which include gloves, face masks, coveralls, to mention but a few, in addition to the general standard operating procedures. Other specific groups, for example, the drivers, the priests, the churches, the schools, all of them, we advise them to use the general standard operating procedures, which include ensuring hand washing and avoiding physical contact. Remember, your health is your priority. Keep safe, avoid physical contact, ensure the standard operating procedures in order to curb the Ebola virus disease. And in case you suspect an individual of having Ebola virus disease, contact the nearby health facility or contact Ministry of Health on the toll-free line 0800 1066. Thank you and see you in our next video. Bye-bye.